Nishant, okay?
Okay.
Because I have to update Shield Connect also.
So it's live now.
One moment, Nishant. Nishant, okay?
Okay.
Because I have to update Shield Connect also.
So it's live now.
One moment, Nishant.
Start, Bharatji.
Yeah, you can start.
Okay. So good morning, participants. Thank you for joining Shield Connect. So today we have a speaker from Odisha. So Dr. Saim Stuti Patnaik, ma'am is consultant obstetrician and gynecologist. Ma'am has done MBBS from Utkal and MS in obstetric and gynecology from RGUHS. Ma'am is laparoscopic surgeon and infertility specialist. Ma'am is working in Shanti Memorial Hospital in Rourkela, Odisha. Ma'am has done fellow in minimal access surgery from Belgium and fellow in reproductive medicine in Germany and fellow in fetal medicine. So, ma'am, we welcome you on our platform, and I will hand over the session to you, ma'am. Thank you, ma'am.
Uh, Thank you. Thank you for a wonderful introduction. And shall I share my screen? Shall we start?
Yes, ma'am, you can start.
Okay, one second. Just a second. Yeah. Just a second. Yeah. Very good morning to one and all, and a happy Sunday to all. I hope this presentation is going to enlighten a little bit of Sunday today. It's a very light and a very not that aggressive topic, and so it's good for a Sunday to start with. But this is something I feel most of us practicing infertility specialists or gynecologists, we are so much into the intricacies and the complications of ART that we forget very small and minute things. Is the full screen visible?
Yes, now it's visible, ma'am. Please carry on.
Yeah. So before I go into the slides, I would want to give a background check, if you would say that this is something which is very it's a very neglected part of infertility practice. I feel it's a number for other things. I think vulvovaginal candidiasis or a bacterial vaginosis or any problem in the vaginal microbiota in our OPD is a very common thing, and of course that is not very much neglected by us. But when it comes to infertility and ART practice, I think it is something which we all neglect. We are more into getting clinical pregnancy rates, take home baby rates, increasing them, talking about air quality, talking about IV flap things, talking about sterility, about the embryology skill, about various other things. But this is a very small and a very simple and a minor thing that we what I feel in places where I've worked and I've seen people, they do not give much of attention to this thing. I think if we all can do this little extra part, it is going to do wonders for us. And let's not skip it. Let's not do everything best we can possibly do for all our patients. And let's have a wonderful night's sleep by giving 100% to our patients. So coming to the introduction of this, we know the vaginal microbiota plays a pivotal role in maintaining the physiological homeostasis of the environment and protects from the colonization by the opportunistic pathogens. A healthy vaginal ecosystem is characterized by a predominance of the lactobacillus species. As we all know, generally we know it is the lactobacilli. You call it, it's crispatus, inners, gasseri, jensini. Most of us don't even remember all these things, but all we know is it is all these pieces of lactobacillus which are there and which actively contribute to lower vaginal pH, that is less than 4.5, the median being 4.7. So 4 to 4.7, 4.8, this is what we all like to achieve through lactic acid production. The vaginal microbiome plays an important role in maintaining women's overall health. It's not only about that vaginal health, it's about the overall health, as we all know about various infections like ascending infections and other things. And this is a very, I feel in India, especially in, may not be in the metro cities or whatever you can say, if we go down to various sections of the society, I think the majority, you know, we see the tip of the iceberg coming to very sophisticated IVF clinics and all that. But what about the you know, middle class and the lower social economic status and all people who also have infertility in their sections, depending upon various ethnicity and all, especially in our part of this western part of this part is what I see, and the neighboring states what we see, they're not, there is a significant amount of infertility, even if people are not very career oriented or this and that and all that. There is some, as we know, epigenetics, progenetics and all that involved in it, and epidemiology, ethnicity, so many factors are there. So what to do about them? Can vaginal infections be a major cause of this thing? And what if we treat and we can do wonders for them with very, very minimal expenditure and other things? So as we all know, you know, infectious part of the infertility, we all know the various reasons for tubal infertility, for failed implantations and other things. So why not take care of this very small and minor part, and let's help and do wonders to people who are not able to maintain that much of hygiene or maintain a pH for various reasons or whatever. So the vaginal microbial community plays an important role in vaginal innate immunity and the inhibition of bacterial, viral and yeast infections. The urogenital site contributes 9% of the entire human microbiome as compared with GIT, which comprises of 29% of the total. So I know it is just 9% of it, but it is quite significant. The vaginal microbiome is dynamic and changes throughout a woman's lifetime and is commonly dominated by the lactobacillus species. As we know, this is the homeostasis. We need to maintain a balance between the harmful and the good bacteria. It's same with our gut also. So unique to each woman, what is unique to each woman in comparison with the GI microbiome? The microbial diversity within the reproductive tract is relatively low. Many different species of lactobacillus are present in the vaginal tract. There are a few that predominate. It plays an important role in determining many aspects of reproductive health. 4 of these groups were classified as lactobacillus, with the majority 34.1% being the group 3, that is lactobacillus inners dominated, followed by group 1, 26.2% of population sampled, that is lactobacillus crispatus dominated, then group 2 and group 5, and then group 4 is classified as non-lactobacillus dominated, which includes your Gardnerella, Pretovella, Corynebacterium, Atopobium, etc. During the reproductive years, what happens? What is the normal physiology? As we all know, just brushing it up, high circulating levels of estrogen and progesterone, lactobacilli dominance in the vagina. So the estrogen leads to the deposition of the glycogen in the vaginal epithelium. The progesterone supports the cytolysis of the epithelial cells. Glycogen release, lactobacilli metabolize the glycogen into lactic acid. And further, we are going to see various enzymes involved in it also. It is not a simple metabolism. So the normal vaginal pH to be 4, or the normal range that we have already discussed about. So coming to the schematic diagram, what do we see? We see different pH in different places. In the vagina, the median pH being 4.7, in cervix it being 7. Then in your fallopian tube, the pH being 7.94, and in uterus being 7. So as we can see in the vagina, it is the lowest, and slowly we can see the pH increasing up to the cervix, uterus and fallopian tube. That becomes more towards the everything above being 7. So the lactobacillus colonization begins in puberty and decreases after menopause. Enteric and anaerobic bacteria are co-dominants in post-menopause. And in childhood, what do we see? E. coli and anaerobes predominate. So childhood, puberty, and then following menopause, what are the changes that we see? The female reproductive tract, as has an active microbiome, and it is suggested that these microbes could influence the outcome of assisted reproductive technologies. Many studies found, as we know, today's era is about evidence-based medicines. Why are we going to worry about it if we do not have a research, we do not have a study which tells us that it does make a difference? Infections do make a difference. Treating infections do increase the pregnancy rates or implantation rates. So we need evidence to prove that. Why are we discussing even about this? Many studies found an abnormal vaginal microbiome had a negative effect on ART. An abnormal vaginal microbiota has been associated with a poor reproductive outcome in patients undergoing IVF, as well as with early spontaneous abortion in patients undergoing IVF. So it's not about just achieving the pregnancy, it is about maintaining also. And most of that, as we all know, a very, very big factor of the first trimester abortions being, I think I need not fill in the blanks, all the practitioners would understand what is the major reason for first trimester abortions. So studies confirm that a vaginal microbiota rich in lactobacillus species, major reason for first trimester abortions, eliminating the genetic chromosomal part, would be this to be noted. Studies confirm that a vaginal microbiota rich in lactobacillus species without bacterial vaginosis, either clinical or subclinical, leads to more positive outcomes with ART. As we can see, it has been proven in 2017 by Babu and Ekter et al., Magon Fernat et al. In 2013. And we can know that various studies have definitely proved that there are positive outcomes in ART with a rich vaginal microbiota with lactobacillus. So Kudor et al. Performed a prospective study of reproductive age women undergoing IVF and found that embryo implantation was less successful in women with reduced lactobacillus species in the vaginal microbiota. So this is also another relationship that we have established, is that a reduced lactobacillus in the vaginal microbiota has led to decreased implantation rates of the embryos. The microbiota in pregnant vagina is less rich and less diverse as compared to non-pregnant vagina, with a predominance of lactobacillus species. A significant higher stability of vaginal microbiota in early stages of pregnancy, and the same is increased with gestational age. The etiology, as we have already discussed, includes the estrogen increasing the thickness of vaginal mucosa, thereby increasing the glycogen deposition. This glycogen deposition acts as a chemotactic agent for microbes, as this is major substrate used by these microbes, which is broken to glucose and then fermented to lactic acid, thereby playing a significant role in lowering the vaginal pH. So the main factors, if we can see in this proper diagram, just to brush up again in our brain, that modify the vaginal microbiota, they being infections, age, and the physiology, as we have already discussed, childhood, adulthood, and postmenopause. Pregnancy, we have already discussed what happens in the early trimesters and how it increases in the further gestational ages, and others, of course. There is always a group of others like the ethnicity, smoking, cancer, and various things. So coming to infections, aerobic vaginitis, pH being 6 to 8, lactobacillary microflora is disturbed. There is yellowish discharge, Staphylococcus aureus, and Escherichia coli are the prevalent organisms. Bacterial vaginosis, as we can see, it is vaginosis and not vaginitis. So it is simply a disturbance in the microflora flora again, pH being less than equal to 4.5, white grayish discharge, inflammatory changes are seen, and Gardnerella vaginalis and Mobiluncus species are the prevalent organisms. In pregnancy, there is a lower concentration of mycoplasma and ureaplasma, decrement in pH as already told, and increment in vaginal secretions. And others, coming to the ethnic groups, as we can see, there are various changes, as we are going to further see the difference between African women, Dutch women, and all that, who are more prone. So definitely there is an ethnicity involved in it. Smoking, it leads to low estrogen levels, presence of BPD in the vaginal secretions, decrement in the lactobacillus species concentration. Cancer, again, depletion of lactobacillus, and high diversity of microorganism being an immunocompromised state. Altered vaginal microbiota flora leads to urogenital problem. As we are well versed with this, and this is not something to be discussed, I feel vulvovaginal candidiasis, bacterial vaginosis, UTI, and PID. I think this is day in and out. We are going to see it, and we all know how it happens and what leads to all this. So lactobacilli, it provides a defense against the pathogen colonization, such as the Trichomonas vaginalis, Candida species, and Gardnerella vaginalis, by producing lactic acid, H2O2, and bacteriocins, and modulating the non-specific host immune response. So this is the microbiology behind it, and simple brush up of the microbiology. They survive under low gastric pH, bile salt, and passage through the intestine, and then ascended without functional intervention into the vagina. Here, what are we going to see? What are we going to be concerned about? Because this topic is about ART, IVF outcome. What are the negative factors leading to a negative outcome? And for a better outcome, we have just one thing, that is lactobacillus dominant microbiota. But for the negative side, what are the things that we see? There is a lower implantation rate, increased number of miscarriages. Again, another disheartening thing after achieving a pregnancy, decreased number of at-term pregnancies, which is also very disheartening, and reduction of pregnancy rate. So the high concentration of Gardnerella vaginalis and Atopobium vagina and low abundance of lactobacilli mostly contribute to reduction in pregnancy rate. Low abundance of lactobacilli, again decreased number, again low abundance. And one more factor which includes all of this, that is lower implantation rate, any kind of infection with high abundance of enterococci, enterobacteriaceae, streptococci, staphylococci, and or gram-negative bacteria, and low abundance of lactobacillus again. So we can see how all this affects negatively the IVF outcome, and how just lactobacillus helps, fighting everything out and increasing the vaginal immunity. So the mechanism of the urogenital colonization, as we can see, there is an ascension from the vagina for sure, into the endometrium, into the fallopian tube, ovary, pouch of Douglas, and the peritoneal cavity. So there is a hematogenous spread of bacteria, that is A. Second is ascending infection from the vagina. The most important being blood, as we can see here. And what are the other ways? That is the retrograde spread through fallopian tubes, through various iatrogenic procedures, ART-related gynecological procedures, as I said. So many factors are there which can again dissipate the infection. So these are the major three routes in which we can find the colonization, urogenital colonization of the microbiome. So absence of vaginal lactobacillus, which is mostly, as we term it, as bacterial vaginosis or BV. So as you can see in these two pictures, the first one being lactobacillus dominant microbiome, we can see the gram-positive rod-shaped bacteria, pH being less than 4, high lactate concentration up to 150 mm. Then coming to bacterial vaginosis, often you can see the stark change in the picture in the histopathology in the microscopic enumeration of the gram-positive rods. We can see often asymptomatic overgrowth of gram-negative or variable anaerobic bacteria like Gardnerella, Atopobium, Prevotella, Snetheria. So many other species are there. I think we are not going to remember that also. So there is a significant order with it. Fishy order, as we all know. Thin vaginal secretions, pH being more than 4.5. And we can see the typical clue cells or the exfoliated epithelial cells as in the picture. Ethnicity, as I said, plays a role in the vaginal microbial composition. As we know, ethnicity is a factor in everything, all kinds of diseases, where you call it cancer, you call it infertility, you call it diabetes, you call it any infection. So there is a role of ethnicity. And depending upon the diet, lifestyle, and over the years, the modulation of the genes in the body. So according to Helios studies, around 100 women of major ethnic groups in Amsterdam were taken. BV 2 times more prevalent in communities with African background compared to Dutch background. So what is the genetic basis behind it? What are the intravaginal practices that we see? So there are various factors. As we said, the diet, lifestyle, the various practices over the years that change and modulate the genes and the physiology of a human body. So we can see there is a stark difference between the change in the vaginal microbiome in various ethnicities, in Dutch population, in South Asian people, in African people, as we can see the red line being very, very high. Of course, it's quite low in Dutch, Turkish, and Moroccan people. Pro and anti-inflammatory effects of vaginal microbiota. As we know, Atopobium invokes innate immune response, interleukin 6 and 8 in cervicovaginal tissue culture, as told by a study. D and L lactic acid at low pH protonated form prevents production of Inflammatory mediators, as we know, interleukin 6, 8 being the major ones playing a role and rantis. Activated mucosal CD4 plus T cell numbers are elevated in women with high risk bacteria. So we can see what are the pro and anti-inflammatory effects of the vaginal bacteria. How do they produce the various reactive oxygen species, interleukins, and affect the flora. Lactobacillus dominance and low vaginal pH are unique to humans. So coming, we spoke about ethnicity and various genetics things. Now coming to various other species, as we can see in human, it is a characteristics of Homo sapiens being a dominance of lactobacillus and low vaginal pH. So glycogen levels in the vaginal lumen are variable, as we can see in the macaques and low postmenopausal women or prepubescent girls, women with bacterial vaginosis, all have low lactobacillus. The common assumption in the field, as we have again and again spoken about this thing, but what we are going to mention here is the lactobacillus cannot directly metabolize glycogen. Human alpha amylase present in the lower genital tract mucosal fluid processes glycogen to support vaginal colonization by lactobacillus. So there are various enzymatic reactions also involved in it, and it's not a very simple phenomenon. A meta-analysis of bacterial vaginosis and the infertile population. Prevalence of bacterial vaginosis to be 19%, asymptomatic in up to 50% of the cases. So this is how we can know what is the intensity of the problem and how much we are ignoring it. May not be intentionally, but how much are we ignoring it, and other factors. It's linked to preterm birth, post-surgical infections, negative impact on female fertility. Effects of ART on vaginal microbiota. Circulating hormones impact greatly upon the vaginal microbiome and the susceptibility of the woman to the infection. That also affects a lot because of the circulating hormones. Exogenous hormones impact upon the vaginal environment. As we all know, what are the changes we see in the vaginal secretions and all, with various exogenous hormones that we keep on giving to the woman, and the composition of vaginal microbiota. 4 months of GnRH analog treatment increased vaginal pH significantly above 4.5. In endometriosis, significant shift towards intermediate vaginal microflora, decrease in normal vaginal microflora. In control group, we can see similar but non-significant shifts. Significantly higher colonization of Gardnerella and E. coli in both groups of women, control and this group. So application of the antibiotic levofloxacin reduced the growth of cultured E. coli. So we need to recognize the problem or the shift in the vaginal pH or the infection, and treatment is going to do wonders. Effects of ART on vaginal microbiome, again, the hormonal influences which have significantly spoken about. Higher CPR in the group with no microbial growth compared with the group whose cultures were positive for microbial colonization. So again, studies have proved that there is a significantly higher clinical pregnancy rate where there is no microbial growth. So significantly lower CPR ongoing pregnancy rates and implantation rates in group with positive cervical culture. So that is the importance again and again I'm trying to emphasize. Effects of ART on vaginal microbiota, coming to ovarian stimulation. Circulating hormones impact greatly on the vaginal microbiome and susceptibility of the woman to the infection as per Heman et al. 2012. Using 16S recombinant RNA deep sequencing and IVF-ET, shift in the vaginal microbiome in some but not all of the women. Novel bacterial strains were found in 33% of the women screened during the treatment cycle. Coming to the down regulation with GnRH analogs, what do we see in that? Exogenous hormones impact upon the vaginal environment and the composition of the VMB. 4 months of GnRH analog treatment, according to Khan et al. 2014, increased vaginal pH above 4.5, significant shift towards intermediate vaginal microflora, and decrease in normal vaginal flora. So VMB on the day of ET. So there is a specific regime, if we can see, to give our probiotics and prebiotics and other lactobacillus rich preparations. So on the day of ET, it does affect the pregnancy outcome. Women with ongoing pregnancy was characterized by top genera by some fraction. Lactobacillus species were the top species. great care to reduce the risk of microbial transfer into the cervix during eating. So what are the various precautions that we can take is cleaning the external os of the cervix with culture medium, as we all know, and we routinely practice it. Avoid touching the vaginal walls and external cervix with the catheter tip. In tubal infertility, as we all know, the various factors, infections and all involved for tubal infertility, abnormal VMB significantly associated with tubal factor infertility, chlamydia trichomonas, trichomatis are more prevalent in BV positive women. So as we can see, when there is a shift to the normal vaginal microflora, we have the all waiting pathogenic organisms to attack, and then from the vagina to the cervix and up above in the ascending form, and hematogenous spread. Components of an abnormal VMB ascend through the cervix into the upper genital tract, causing pelvic inflammation and reduced infertility. As we all know, the moment we put a scope, we look at the signs of PID, we look at signs of tubal structure and other things. And most of the cases in our country setup, especially, we know what we find. So I think this is something not to be told, and how ascending infections and how PID with chlamydia and other things cause, and what is a picture that we see in a diagnostic hysterolaparoscopy is very well versed by everybody. In patients undergoing fertility treatment, BV and abnormal lower genital tract microbiota was significantly more common compared to the general population. 1 in 5 infertility patients having BV. 1 in 3 having a disturbed vaginal microbiota. BV does not affect on conception rates. So these are a few findings that we have, and it is very significant. 1 in 5 infertility patients having BV is quite a big fraction. 1 in 3 having a disturbed vaginal microbiota is also a great fraction. And the other studies, as we all know, so there is a difference between achieving conception, maintaining the conception, preterm births, miscarriages, and full-term births. So various factors are involved at various stages. I think vaginal microbiota is important, not simply just achieving pregnancy. Infertile patients undergoing IVF assessed the prevalence of BV among using both Nugent score and PCR, as we can see in the previous picture that had shown between a normal lactobacillus rod-shaped bacteria and the ones with clue cells and all. There was a score called Nugent score. So implantation rate was reduced in those women who were BV positive compared to BV negative. We have established it quite a lot. So we can see significant reduction, 27 and 36, significant. Difference was not statistically significant, as I said, but the various studies have definitely proven that implantation rate was much higher in a normal microbiota. Contamination is possible from vaginal cervical microorganisms by needle puncture of the vagina. Microorganisms that enter the endometrium from the cervix during embryo transfer could damage the developing embryo and prevent pregnancy. So while we are doing the embryo transfer, we need to be very careful for not damaging the developing embryo and preventing pregnancy. Pathophysiology of vaginal imbalance in female infertility. It increases the concentration of interleukin-1 beta in vaginal environment, triggers the generation of reactive oxygen species, affects the membrane integrity and flexibility, impairs both tail motion and sperm oocyte fusion, and disrupts fertilization and implantation. So this is another pathophysiology of the vaginal imbalance, and how it leads to female infertility is not simply the presence of bacterial vaginosis or other species and lactobacillus. There is another inflammatory process, and undergoing process which triggers the generation of ROS and various other oxygen free radicals, and it disrupts the membrane and the various protective mechanisms of the membrane, and it affects the sperm oocyte fusion and the tail motion of the sperms, and leading to the dire consequences, as we can see. Coming to probiotics, the hallmark of a healthy VMB in most women, the relative abundance of lactobacillus species is what we want to achieve. This is another what we have already discussed so far, starting from follicular phase to luteal phase to fertilization, implantation, and pregnancy. The various things that we can see: normal healthy microbiota, reduced pH, protects against pathogen growth, blocks the adhesion of pathogens, promotes supportive environment for fertilization and implantation. And then what happens during pregnancy? It helps regulate host defense mechanisms, produces antimicrobial compounds like bacteriocin and H2O2, and increases the lactobacilli. So these are the various protective mechanisms in various phases of menstruation and fertilization, implantation, and pregnancy. So when it is disrupted, they're more prone to STDs or STIs, sexually transmitted infections, PIDs, cervicitis, pro-inflammatory cytokines, as we've already mentioned about various interleukins and other factors which are involved in it, affecting the sperm-oocyte fusion and the sperm motility, affecting the tail component. And during pregnancy, what are the various things that can be affected by it? We all know amniotic fluid infection, chorioamnionitis, late miscarriages. As I said, they're very disheartening because of these reasons. Premature rupture of the membranes, preterm birth, virus reactivation like the herpes simplex or a cytomegalovirus, and again leading to a pregnancy loss, low birth weight, and postpartum endometritis. A healthy vaginal microbiota can help to prevent urogenital conditions such as UTIs and bacterial vaginosis. Therefore, studies leading to a better understanding of the VMB will facilitate the discovery of improved treatments and diagnostics for such conditions. And simply not writing an array of antibiotics and all that, specific, I think, treatment is very, very important so that it does not lead to, over treatment of the problem. So coming to this thing, what fertility specialists should know about the vaginal microbiome? What is that should concern us? As we've already discussed, the microbiology, the pathophysiology, and the various changes. And our goal is specific treatment for the specific infections and to identify them at the right correct point of time, whether it is before the ET, during ET, preconceptional period, during pregnancy, or whichever part of the time that we witness it. The vaginal microbiome composition varies between women and has the capacity to fluctuate throughout a woman's life. The abundance of various bacterial species in the vagina greatly impacts a woman's reproductive health and pregnancy outcomes. The vaginal microbiome may be altered by exogenous factors that may impact reproductive health outcomes. So this is the key message which we get from this study. Probiotics containing lactobacillus used over a long period of time. They're an alternative to antibiotics, particularly within the context of high infection recurrence rates. Probiotics, according to WHO, probiotic is defined as live microorganism which, when administered in adequate amounts, confer a health benefit on the host. So, what are the characteristics of potential probiotics? Acid and bile stabile, human origin, production of antimicrobial substances, adherence to human intestinal cells, persistence in the human intestinal tract, clinically validated and documented health effect, antagonism against enteric pathogens, susceptible to antibiotics, and safety in food and clinical use. These are the various characteristics to consider while choosing a probiotic. Coming to prebiotics, what are prebiotics? They're compounds in food that induce the growth and activity of beneficial microorganisms. So prebiotics plus probiotics, that is symbiotics, they would help us achieve our normal vaginal microbiota. So prebiotic stimulates the growth and reproduction of only useful microflora, maintains an optimal pH in intestine, stimulates local immunity, removes excess mucus from the walls of the small intestine, reduces the formation of gases, suppresses the reproduction in the intestines of pathogenic bacteria, stimulates peristalsis, improve the work of the digestive system. So we see a stark difference between the characteristics of a probiotic and a prebiotic. We therefore wanted to answer the following questions. Like, what are the various questions we come across? Is the presence or absence of certain bacteria associated with failure to become pregnant after an IVF or an IVF-ICSI treatment? Can the composition of the vaginal microbiome be used as an independent predictor for IVF or IVF-ICSI outcome? Our results indicate that vaginal microbiome profiling using the IS-PRO technique enables stratification of the chance of becoming pregnant prior to the start of an IVF or an IVF-ICSI treatment. So knowledge of the vaginal microbiota may enable couples to make a more balanced decision regarding timing and continuation of their IVF or IVF-ICSI treatment cycles. So many couples can subject themselves to this stratification technique and find out the chances and the risks and the ratio. Differential composition of the vaginal microbiome, but not of seminal microbiome, is associated with successful IUI in couples with idiopathic infertility. It's a prospective observational study whose results strengthen the potential role of lactobacillus in promoting a favorable environment for pregnancy and suggest that the microbiome characterization could be useful together with standard clinical and laboratory assessments in the pre-IUI evaluation of infertile couples. As I said, this is a very important thing. So before we end up in the wall, why not make sure our ropes are intact? So vaginal and seminal microbiomes have gained increasing interest for the involvement in reproductive health and fertility. Their role in reproductive outcome is not fully understood yet, but this study at least correlates the vaginal and seminal microbiome of 23 couples with idiopathic infertility to the clinical pregnancy rate after IUI. So we can definitely come across and see how it has made a difference. Abnormal vaginal microbiota may be associated with poor reproductive outcomes. A prospective study in IVF patients, another study, as we can see, it negatively affects the clinical pregnancy rate. If a negative correlation between abnormal vaginal microbiota and the clinical pregnancy rate is corroborated, patients could be screened and subsequently treated for abnormal vaginal micro. As I said, the pre-IUI period and whatever stage are we going to come across, and it's better it does not go untreated, as we remember that untreated bacterial vaginosis led to so many issues and problems. Relevance of assessing the uterine microbiota in infertility. So coming to the uterine microbiota, the study of endometrial microbiota as with other low biomass microbiota prevents important hurdles because due to the small amount of starting material, they're easily contaminated by exogenous bacterial DNA. For this reason, careful and appropriate investigation of the endometrial microbiota is of outstanding importance to detect uterine dysbiosis that may impact the reproductive function. We are all talking about the cervicovaginal flora and the importance, but what about the endometrial microbiota? So we need more researches and studies and to find out, does it have a role in, as you know, this article by ASRM 2018, Fertility Sterility 2018, saying that it definitely has a role. Endometrial microbiota is of outstanding importance to detect uterine dysbiosis. So these are very, very simple factors, as I've been imposing from the beginning, that microbiota of whether you call it tubes or endometrium or the POD or the associated other organisms that could be present at various places. So they all definitely contribute to infertility, because we can see the percentage of this unexplained infertility going very, very high. Potential influence of the microbiome on infertility and assisted reproduction. And also, before going into this thing, I would like to mention there is a significant role of lifestyle change. As we can see in various ethnic groups with different lifestyles and smoking and other factors, they also lead to the more prevalence, as we can see with the career-oriented women and other places where we have a little unhealthy lifestyle with a lot of habits which are not welcome, leading to various changes in the pH in the vaginal microbiota. Again, another reason why this field, which is generally neglected, has to be, at least looked upon and at least detected as much as we can and treated, because it's very simple to detect and treat. Potential influence of the microbiome on infertility and assisted reproductive technology. Meta-analysis demonstrated that BV is significantly more prevalent in women with infertility. Again and again, various studies have proved these are all that I'm telling, different studies, as you can see written up there, but the same analysis has come out everywhere. Women with tubal factor had significantly higher prevalence BV compared with women with other causes of infertility, as I've already mentioned before, with higher prevalence of BV leading to higher prevalence of chlamydia and other infections and tubal infertility, blockages and other things. 40% of the patients undergoing ART have bacterial vaginosis. So here, this one line would tell you how important it is. The normal flora of the reproductive tract includes a variety of lactobacillus species which promote a healthy, supportive environment for the embryo in the pre and the periconceptual period. Lactobacilli provide a safe environment for implantation. Lactobacillus comprises 90 to 95% of the total bacterial count in the reproductive tract, with 4 species with numerical dominance, as we've already spoken about it, with lactobacillus inners being the maximum, around 36%, followed by group 1 and group 5. Two main attributes of lactobacilli have been shown to play a pivotal role in shifting the balance of the reproductive tract environment in favor of successful implantation and pregnancy. Lactobacilli produce lactic acid, which lowers the vaginal pH and makes it an unfavorable habitat for many pathogens. Again, the basic thing. So it is lactobacillus, lactobacillus, and lactobacillus, whether it is for our cervicovaginal secretions, for our GIT, for whatever. I think this is a wonder species that we have, and it is most welcome at every place. Live birth rate has been directly correlated with recovery of hydrogen peroxide producing lactobacilli from the embryo transfer catheter tip, and inversely correlated with BV. So as we can see, this is another major conclusive factor, that with the recovery of H2O2 producing lactobacilli has been found from the ET catheter tip. So quantitative assessment and identification of specific microorganisms of the cervicovaginal microflora would increase the accuracy of available tools for diagnosis of infertility and improve the adoption of therapeutic protocols. So subclinical alteration of the cervical vaginal biome in women with idiopathic infertility. As I told you, this zone of idiopathic infertility, unexplained infertility, is calling us and is, I think, forcing us or coaxing us to go into the unexplored places and the unexplored, pathogenesis of infertility. The receptivity cohort study protocol to validate the urogenital microbiome as predictor for IVF or IVF ICSI outcome. So coming to this prospective study by 300 women of reproductive age and with an indication for IVF with or without ICSI treatment will be included. Prior to IVF or IVF ICSI treatment, these women provided a midstream urine sample and a vaginal swab. The endpoints of the study were achieved after fresh embryo transfer and with subsequent year after inclusion. So the discussion here is the predictive knowledge of the microbiome profile may enable the couples to make a more substantiated decision on whether to continue treatment or not. Hence, the unnecessary physical and emotional burden of a failed IVF or IVF ICSI treatment can be avoided. The vaginal microbiome is a tool to predict IVF success, as we have already told. We have mentioned about the IS Pro stratification technique in which we can find out this thing, and we can pre-evaluate in the preconceptional period and to go ahead with it or not. Effect of the vaginal microbiome on the pregnancy rate in women receiving ART. So the vaginal microbiome can influence the results of ART. The profiles dominated by lactobacillus were associated with achievement of pregnancy. So this is another study in the Journal of Assisted Reproduction and Genetics. So the various studies are concluding the same thing, that the evidence that the endometrial microbiota has an effect on implantation success or failure. This is about endometrial microbiota. The results demonstrate the existence of an endometrial microbiota that is highly stable during the acquisition of endometrial receptivity. As we see the various things that we see with failed implantations, we go for the endometrial flow, but endometrial microbiota analysis is something that we do not do it routinely. However, pathological modification of its profile is associated with poor reproductive outcomes for IVF patients. This finding adds a novel microbiological dimension to the reproductive process. Again, as we can see in the European Journal of Obstetrics, Gynecology and Reproductive Biology, BV treated 49% and BV untreated is 24%, just half of it. So this just one chart is going to explain how important it is. So I think I have been able to tell you people how vaginal microbiota, and again I would also mention this endometrial microbiota, are responsible for achieving a good pregnancy and maintenance of the pregnancy and further later, and the importance of the identification in the preconceptional period and the detection at any point of it rather. And a very simple genre, a very simple maybe reason for unexplained or idiopathic infertility, and if detected at the proper stage and treated, can give, can do wonders and give happiness to our infertile couples and blessings for us. So I think I was able to explain to you people that about the vaginal microbiome. and the rest I would shift it to Shield. And I would thank all the people for giving me this opportunity and helping me do it. So thanks a lot.
Thank you, ma'am, for giving all the detailed information regarding how vaginal microbiome is important in the ART.
Yeah.
So,
Yeah.
ma'am, we have some questions from
Yeah, if you
delegates.
could give me just one second, because I have an important call coming and it's
Sure,
for a
ma'am.
delivery of a thing and he's just going on calling me. Just 1 second. I
Yes,
will
ma'am,
just
sure.
give him the OTP and just 1 second.
Okay, ma'am.
Yeah, Mr. Nishant, are you there?
Yes.
Yeah.
Yeah, please go ahead. I'm really sorry for the interruption. That was an important call. So please go ahead.
Yes, ma'am. No issue, no issue.
Yeah.
So we have three questions.
Yeah.
First question is how many cases do you receive of miscarriages due to vaginal dysbiosis issue?
Yeah, see, as we know, there is no particular record of it because
Yes.
it is something that we have to go into retrospective analysis of whether the
Mm-hmm.
woman had what kind of infection she had, what kind of what was the color and the order of the vaginal discharge. And because we routinely do not take a vaginal swab and send it for testing for all the patients, I think that should
Mm-hmm.
become a routine test if that is the reason. That can be incorporated if a woman is having recurrent cervicovaginal secretions or discharges and she is apprehensive about that. We can definitely go for testing. And I feel it is a very, very big factor for first trimester abortions and for failed IUIs or failed implantation or failed IVF ICSI cycles. So it is a very considerable proportion of it. There may not be a very quantification of the thing, or the exact number can be told to all of you, but I think this is something that is very much prevalent. So it is not a small amount. That's mostly that I can tell.
Then the second question is, ma'am, can biotherapeutic products like probiotics can be helpful in fixing preterm birth issues after failure of antibiotic therapy?
Yeah, sorry, can you repeat it again?
Can probiotics be helpful in fixing preterm birth issues after failure of antibiotic therapy?
Mm, as we have already spoken about it, the role of prebiotic and probiotic mostly is in the preconceptional period, and it is effective only when taken over a longer period of time. Yes, of course. So when there is recurrent vulvovaginal candidiasis or bacterial vaginosis and
Yes.
all, they do have a big role to play. But Antibiotics definitely are the mainstay of treatment, the first line of treatment. And if failure is there, of course, we're going to try everything possible to get the treatment done properly. So I think there is no harm in trying probiotics or the ingestion of probiotics, but how far they would be helpful in failure of antibiotics is a concern. So always a culture of the thing is more important to find the specific microorganism and treat accordingly. So failure of antibiotics mostly is because when it is not correctly detected the organism, the nature of the infection, fungal, bacterial, or whatever. So I think we need to identify that first to prevent failure of antibiotics rather than simply shifting over to prebiotics or probiotics.
Ma'am, the third question is probiotic use helpful in implantation for good pregnancy rate before starting any complex IVF treatments?
Yeah, of course. Before starting complex IVF treatments, we can definitely go ahead for ingestion of these prebiotics and probiotics. There is no harm, rather it is beneficial for us. So that is the whole motto of explaining what is the importance of lactobacillus and probiotics here. So definitely there is a significant role.
So thank you for giving all the answers to these questions, ma'am. And we
Yeah.
are glad to have you on our platform, and you are giving webinars with us continuously. So thank you for supporting us on Shield Connect, and ma'am, we would like to have more sessions with you in future.
Thank you. Thank you so much.
Yeah. Thank you, ma'am, for joining with us today, madam. Thanks for the wonderful presentation, ma'am.
Thank you. Thank you so much.
Bye, ma'am.
Thank you, ma'am. Today's presentation was very excellent. Thank you, ma'am.
Thank you. Thank you so much. Thank you.
Okay, ma'am, shall we wind up, ma'am? Shall we close?
Yes. Please go ahead.
Okay. Thank you, Biplabji, Nishant. Thank you so much.
Thank you.
Yes,
Bye-bye.
thank you, sir.